Dana, are we ready to start? Hello, good afternoon, everyone. Thank you for joining us. My name is Joe Coffaro. I'm with the
Sorry, just 1 second. I'm still waiting on a couple of speakers, but I'll go ahead and introduce you and then we'll get started. Just one more minute.
That's what I was waiting for. Thanks.
Good afternoon, everyone, and thank you for joining us on the news briefing this Wednesday, January 21st. To start, we'll be hearing about the Community Health Needs Assessment, which is a countywide effort that looks at the health status, behaviors, and needs of residents across Monterey County. This assessment was conducted on behalf of the Monterey County Health Needs Collaborative, which is a partnership of local hospitals, health organizations, and community agencies. The findings from this assessment are intended to help identify priority health issues, reduce health disparities, and improve access to preventive services for residents throughout the county. Here to share these findings with us today are Joe Coffaro, Regional Vice President from the Hospital Council of Northern and Central California. We also have Katy Castagna, President and CEO of United Way Monterey County. And we have Vicente Lara, Program Manager with the County of Monterey Health Department. Thank you all for being here today.
Thank you. Thank you for the kind introduction, and thank you for all those who are attending. So, first of all, who are we? The collaboration was founded in 2021. The Monterey County Health Needs Assessment is a partnership between the hospitals and community agencies, organizations, and the public health and the health department to really focus on the needs. Every 3 years, hospitals, nonprofit hospitals, have to conduct a community health needs assessment. This in 2021, the health department had actually partnered with us to go ahead and continue doing the community health needs assessment. With that, we had great we had sorry, somebody says that they're not hearing. I hope people could hear me.
I can hear you from my end.
Okay, thank you. And from there, we decided to do it again. So every 3 years, now we are in the process again. With that process, we had gone ahead and created, we ended up getting new partners. And there's somebody else who says they cannot hear. So I hope people are able to hear me. With that, we were able to go ahead and include new partnerships within the health needs assessment, which was actually with our other providers, which is with the Alliance and CSUMB. Thank you. People could hear me. Some can, some cannot. I apologize for that. With that, the needs assessment, again, is more of a collaborative to save money, to help folks to get a better understanding countywide, and to be able to really focus on the needs that that people are putting together and highlighting. And together we are able to work with our partners to really access those dollars that we have within hospitals, within the county, and nonprofits to deliver best care services to individuals within the community. I will go ahead and hand it off. But before I do that, the Hospital Council of Northern Central California was the individuals we brought the collaborative together. We were able to really help drive this together with all the partners. And I will go ahead and kick it off on over to the county, to Vicente.
All right. Can folks hear me? I want to make sure.
Yes.
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 Okay, perfect. Thank you. All right, excellent. Let me see. Just to confirm, was I sharing the slides?
Yeah, if you can, that would be great.
Okay. All right. Let me pull that up real quick. Shoot. Give me a sec. Hold on, I'm just putting these up. Ah. Okay.
If you're having issues, we do have your slides. So if you want, we can pull them up from our end.
If you could, that'd be great.
Okay.
I'm having.
Dina, do you mind sharing your screen? We're gonna have Dina share her
Thanks,
screen.
Dina.
There we go.
Great, thank you.
Dina, if you can go down a couple more pages. So where it says population survey.
Okay, perfect. Yeah, that's it. That's excellent. Okay. So thank you again. My name is Vicente Lara. I am a program manager with the County of Monterey Health Department, and just going to give a overview of some of the findings that we identified in the 2025 Community Health Needs Assessment. Before I jump into our findings, I do want to just talk briefly about where all this wonderful data came from. And for the 2025 Community Health Needs Assessment, we had our wonderful consultant PRC administer roughly 800 surveys countywide. Well, our local collaborative, which included, the health department, Natividad Hospital, a number of community partners and others, who helped collect an additional 2,200, roughly 2,200 surveys by promoting the survey link and going out and talking to residents in different areas throughout the county to collect the 2,200 surveys. It was definitely a collective effort, and we really appreciate everybody's support and for those who really helped get the word out about our needs assessment this year. In total, we had about 3,000 surveys that were collected across Monterey County. And of those, 396 came from South County, about 1,583 came from the Monterey Peninsula area, 792 from Salinas, and 234 from North County. And of course, with such strong participation in the survey, this really gave us a good understanding how residents across the county are experiencing health and access to services. So really, really important. Let's go ahead and go to the next slide. And again, I also just want to talk briefly about how representative the data is. Now, given that we collected roughly 3,000 surveys, the sample size actually provides a overall maximum confidence interval of plus or minus 1.8%, which is really good. And the final data set was weighed to reflect the county's population, which helps ensure that the results that we're looking at and analyzing are not over or underrepresenting any particular community. And so this slide is just kind of a snapshot of what the county population is and how we weighted the results to really try to get as close to the county population as possible. All right, let's go ahead and move on to the next slide. Perfect, thank you. Now, obviously, beyond the number of surveys we collected, it's what's really valuable is just how much information we were able to collect with our community health needs assessment. Community input and the surveys provided insight into more than 200 indicators that spanned across 6 health domains. So again, if anyone helped get the survey out or completed the survey itself, a huge thank you. It took roughly 20 to 30 minutes to complete the survey, so we know folks did dedicate quite a somewhat of time to complete the survey. So we really appreciate everybody's participation in that. And then the data was analyzed by region, age, gender, race, ethnicity, income levels, sexual orientation when applicable. And for this presentation, we're not going to go through all 12 areas of opportunity. We're going to cover access to healthcare services, cancer, diabetes, heart disease and stroke, mental health, and nutrition, physical activity, and weight during today's call. All right, let's go ahead and move on to, we'll start with overall perception of how residents perceive their overall health. So in 2025, just under 19% of respondents reported experiencing fair or poor overall health. This percentage is slightly lower than the state average, but higher than 15.7%, indicating that a significant proportion of residents continue to experience poor health outcomes. It's also important to note that there's some regional categories that are fairly broad. So like, for example, the Monterey Peninsula area did fare better overall, but there are some smaller, sub areas such as Marina and Seaside where outcomes were a little less favorable. But this pattern shows not only here, but across several indicators we'll discuss today, including food insecurity, mental health, diabetes, and overall weight and obesity. So let's go ahead and move to the next slide, which we're going to talk about cause of death. So using secondary data from the CDC, heart disease and cancer were among the leading causes of death in Monterey County in 2023. What's interesting here is that the same conditions were also identified by community and community members as top areas of concern in this survey. So this aligns between the lived experience that our residents shared through the survey, as well as secondary data, which again reinforces why these issues continue to be priority areas and an area for focus in terms of action and really trying to address those concerns. All right, let's go ahead and move on to the next. We'll talk a little bit about access to care, which again continues to be an important area to focus on. And when we look at barriers to healthcare access, we do see some mixed trends. Fewer residents report having a regular source of primary care. Compared to the national averages, Monterey County residents experience higher barriers related to getting to a doctor's appointment, finding a doctor, accessing care at convenient hours, and the cost of a visit. Since 2022, we've seen some improvement in barriers related to inconvenient office hours, cost of a doctor visit, prescription costs, and language access. However, getting to a doctor's appointment remains a major challenge, and access to healthcare services overall continues to be a barrier for many residents here in the county. All right, we're going to shift over to cancer outcomes. And again, the picture is somewhat mixed. Overall, cancer mortality rate has declined. It's dropped from 142 to 134.8 per 100 population. At the same time, we're seeing some concerning trends at the local level. Breast and cervical cancer screenings have decreased, while breast cancer screening remains, above the national average. Is still below the Healthy People 2030 target. Cervical cancer screening has declined since 2022 and is below both the national percentage and the Healthy People 2030 target. One bright spot is colorectal cancer screenings, as it remains above both the national and the Healthy People 2030 target. All right. I'm going to move over to diabetes. Diabetes continues to be a key underlying driver of several health outcomes. Since 2022, kidney disease mortality, which is closely linked to diabetes, worsened, increasing from 9.5 to 14.7 per 100,000 residents. The prevalence of diabetes rose to 11.1% in 2025. And when we break the data down by demographic and socioeconomic factors, we do see some disparities. For example, age, there's a sharp upward trend as age increases, peaking at 19.1% for residents aged 65 and older. When we look at race and ethnicity, we observe the highest prevalence rate among Black residents at 30%, followed by Asian residents and at 14.6%, and Hispanic residents at 10.8%. And income is also another area where we see a disparity, where those with very low income in the very low income bracket show a higher prevalence, 14.6%, compared to those in medium and high income brackets at 9.8%. All right, go ahead and move on to cardiovascular outcomes. So looking at heart disease in Monterey County, it did increase from 6.7% in 2022 to 9.2% in 2025. Stroke outcomes also worsened, with rates increasing from 34.1 to 42.5 per 100,000 residents over the same period. And additionally, the prevalence of high blood pressure and high blood cholesterol, both key risk factors, and is higher in Monterey County than in California, across when compared to the state average as well. And we'll look at the behavioral mental health outcomes here. And since the 2022 Community Health Needs Assessment, the percentage of individuals that report experiences of fair or poor mental health declined from 34.3% to 27.5%. However, the percentage of those diagnosed with depressive disorders increased to 30.8%, and those who reported a typical day as extremely or very stressful increased to 21.9%. Of our county residents, women, younger adults, and those with lower incomes are at higher risk for poor mental health outcomes. And we'll go ahead and close by talking a little bit about trends related to nutrition and physical activity. 71% of Monterey County residents are classified as overweight, with a body mass index of 25. This rate is higher than both the state and national average. Of those residents, 35.4% are classified as obese, with a BMI over 30, underscoring the need for prevention-focused strategies that address both the individual behavior and broader environmental factors, looking at things like the built environment and things like that, access to physical activity opportunities, etc. So with that, I'm going to go ahead and pass it over to our partners at United Way, and we'll talk a little bit about how we'll be using the data moving forward.
Thank you, Vicente. Hi, everybody. I just want to point out that in addition to just this real brief snapshot of indicators highlighted here, there are a number of indicators related to what we call social determinants of health, factors such as housing, financial capacity, and education level. And these issues have very direct impact on the health needs of our community. And they are addressed by many different community-based organizations beyond our traditional healthcare providers. This community health needs assessment provides context and opportunity for all of us to prioritize our activities, both within our organizations and then together as a community. Using this common data set, we can better understand not only our county averages, but we have the ability to disaggregate data by region to really slice and dice the data and better understand health impacts and those social determinants by region, age, race, and income level, just to name a few. It's also exciting to have now the second iteration of this. So as Vicente pointed out, we can see some trends compared to our assessment from 3 years ago. These insights help us with strategic planning and provide some common measurements for collective impact. They also help us to be more targeted and specific in developing programs and aligning our funding requests. Next slide, please. So we're seeing some improvements, as I said, in the comparison across the two recent studies. There's also some backtracking, and overall still a lot of work for all of us to do. As a follow-up, United Way is hosting the website and the report, which we encourage you to check out for yourself. The URL for that report is here. There's a lot of very rich data that I hope our community uses and puts to our collective purpose. The overall report is now available, and we'll soon be posting hospital-specific reports tailored to their service areas and their selected priorities. Once again, I just want to say what a huge accomplishment this project is as far as coordinating across many different health systems and healthcare providers, and being more efficient and more proactive about gathering information that can be very actionable for the benefit of our community. On February 11th, we are going to be hosting a health data dive event, really focused on community-based organizations and others interested in learning how to best use the data and the interactive tools that have come out of this. We will be providing information about that event upcoming. And again, I hope that the community recognizes the value of this resource going forward, and that it helps all of us point in the same direction. And I want to thank everybody for the opportunity to have United Way at the table as part of this amazing collaborative.
Thank you. Yeah, thank you so much. We really appreciate that, really great findings. And I do want to ask, because you did mention collaboration, which is a big part of this project, is a collaboration between the agencies. And so I would like to know, why was it important for it to be done collaboratively? How was that decision made?
Well, I'd like to reflect on 12 years ago when United Way Monterey County was doing our Impact Monterey County assessment of the community. We went looking for data, and we found that each hospital had a really wonderful assessment of community health needs, but that they were all separate. And we kept asking the question, well, what would happen if everybody combined forces and lowered costs and was more strategic and aligned in selecting key informants? Because many of the same community-based organizations and subject matter experts and community members were asked similar questions by multiple entities. So I think it was really just observing that we had some duplication, and that, together we could come up with a much stronger product that was aligned for everybody's purposes.
Yeah, awesome. Well, it's really great to see this collaboration come together. Another question that I did get, so there was mention of a 2022 community health needs assessment. And so what is the difference between this assessment that we have here and the one from 2022 in regards to the process? Was the process different from 2022?
Process was not different, and I welcome any of the hospital partners to join in. We were in 2022, we were able to really sit down together with all the partners, with the health department, United Way, and the hospitals to really come up with not only just some basic questions we have to include for the assessment, but also really digging deep and seeing, where are the questions, what are the things, the trends that we keep on seeing and hearing throughout the different communities that we serve. And within that, the really cool thing that we've been able to do that is unique to other communities in other counties is that we were able to come back together, all of us together, collaborate with those same questions, and being able to see where we can move the needle or where we took some steps back. So the whole process is that we hope to continue to do this in the coming years to really be able to really pinpoint our progress and being able to help the community just get healthier as we continue to grow together.
Great, that was a great answer. Thank you for that. Well, I'm not seeing any other questions come in. But if we do get any, we'll be sure to send them your way. But thanks again for being here today and for walking us through this assessment with really some valuable information that you've shared. And we'll be sure to share this with our media partners and appreciate you being here today.
Thank you.
And so now, speaking of health, it's winter, which means that flu season, as well as other winter respiratory viruses are circulating. And this time of year is often when families see higher rates of illness. So today we have Dr. Edward Moreno, Monterey County Health Officer with the County of Monterey Health Department to share some preventative measures and ways to stay healthy during this winter season. Hi, Dr. Moreno. Thanks for being here today.
Hi, thanks for inviting me. So yes, good afternoon, everybody. So yeah, Dr. Moreno, I'm the health officer for the County of Monterey and the public health director. And as was just mentioned, during the winter and early spring, we typically see a seasonal increase in transmission of viruses that cause respiratory illnesses. Our healthcare providers locally have been reporting to public health an increase in respiratory illnesses in their own practices, and they're seeing patients with nasal congestion, cough, sore throat, and occasionally fever. But they're also seeing patients with worsening symptoms, which include shortness of breath and difficulty breathing. And in addition, our hospitals have been seeing some patients in their emergency departments and have had to admit some of the patients with more severe illness. Now, so there are several viruses responsible for these seasonal illnesses. In the past, we often refer to this as flu season, but there's several viruses. So another way we refer to this time of year is respiratory virus season. So the viruses include influenza virus, COVID-19, and RSV, among others. And we in public health just want to remind people that the best way for people to decrease the likelihood of being hospitalized or dying from these viruses, or to decrease the likelihood that your children will be hospitalized or die from these viruses, is to stay up to date on the recommended COVID-19, RSV, and influenza vaccines and immunizations that are available. And anyone who has any questions about which vaccines are recommended for them or their children can check with their healthcare provider, or they can also check with their local pharmacist.
Great. Thank you so much for sharing that information. I do have a question and you know, it's sort of we see this happen normally during the winter time, and I'm wondering if you can answer why winter is typically a time when these respiratory illnesses become more common.
Sure. I'll try. So one of the explanations that we commonly hear is that during the winter months and early spring, when it's still relatively cool or cold outdoors, people tend to spend more time indoors together. Also during the winter months, there's fewer daylight hours, and so people spend more time indoors because there's fewer hours of daylight each day. And as a result, people are spending a lot more time in close proximities to one another. And as people come down with one or more of these respiratory virus illnesses, it's more easily spread to other people in the households, in the work site, in classrooms, where people are spending more time together. So that's one of the potential reasons why we tend to see increased spread. It's not maybe not it may not seem so obvious here in our Central Coast area because we tend to have a little better weather during the winter months, but we very much see this in the Midwest and the New England and East Coast area where it's much colder weather, much more storms that keep people indoors a lot more, and the transmission can be much higher in those parts of the country.
Yeah, thank you for that. Are there any common misconceptions that you hear when it comes to these respiratory illnesses?
I think that everyone has heard a lot of the recommendations that I just shared, and I think people decide for themselves whether or not they're going to get vaccinated or have their kids vaccinated. But again, the best way to prevent serious illness is to get vaccinated. But whether someone chooses to get vaccinated or not, there's still some other ways that people can protect themselves and decrease the likelihood that they're going to get sick or decrease the likelihood they're going to get seriously ill. And that includes some simple recommendations, such as staying home when you're not feeling well. Because when you're not feeling well, when you've got the cough, you got the congestion, especially when you have the fever, you're most likely highly contagious. And by staying home, you decrease the likelihood that you're going to spread it. By keeping your kids home, you're less likely to have your kids spread it to other children in the classroom and to the staff at the school. The other would be to wash your hands frequently, because some of these viruses can survive on the hands of people who are sick. If you shake someone's hand and they're sick and they've got the virus in their hands, and you touch your mouth after that or your face, you can get sick, or touching other objects in and around the work site of the home where someone has sneezed or coughed on those surfaces could also spread virus. So washing your hands frequently, and if you don't have soap and water available, using some hand sanitizer is another way that people can decrease the likelihood that they're going to get sick this winter from one of these respiratory viruses.
Yeah, thank you for that. I think a lot of the times these may seem simple, but it's also a really good reminder. I do want to share, speaking of vaccinations, I want to share my screen because there will be a free vaccination clinic, and that's happening on Saturday, January 24th from 10 a.m. to 1 p.m. And that's going to be at Gavilan View Middle School. So we'll be sure to share this on our social media, and this is a great resource for everyone who wants to get vaccinated. Thank you so much, Dr. Moreno, for being here today. We really appreciate all of the information you've shared.
My pleasure. Thanks.
Thank you. Last but not least, something very exciting reopened last week. After almost 3 years of closure, Regents Slide in Big Sur reopened as of last Wednesday, January 14th, and travelers can now drive uninterrupted from Monterey County to San Luis Obispo. Here to share this update, we have John Olejnik, External Affairs Chief with CalTrans. Thank you so much for being here.
Thank you for the invitation. Glad to be with everyone today. Definitely last week was big for us. The opening of Regents marked the 3-year anniversary of the highway being closed. A slide occurred, Paul slide in January 2023 on January 14th, and then Regents slide after that. And then with the completion of Regents slide, it just happened that it was 3 years to the day. So again, it was a very big deal. We're really happy to get the road open again. There's really four main things that I'd like to convey, and then happy for conversation or however we like to carry it afterwards. The first thing is that we completed the work safely. There was not any significant injury to any of our workers regarding to the work. And that was a feat because it was a very treacherous site, and the slide was actively moving beneath us at times. The second point I want to share is that the slope itself is stable. The strategies that we used in the repair work included drilling in about 4,700 steel dowels into the mountainside and grouting them. If you laid those steel dowels end to end, it'd be about 50 miles worth of steel that's been drilled into the mountain. And while the rains of a couple weeks ago, it did bring down some rock and mud debris from the lower part of the mountain, the slope itself stayed stable and it performed that as we hoped to. And then the third thing I want to mention is that opening of Highway 1, this is super important for the community. It's very important as an economic driver, not just for the region, Monterey County, but really the state as a whole. We know that if Big Sur is closed, people will not travel to California because if Big Sur is part of their trip, they'll just defer their trip to another time. So we recognize the importance of getting the highway open. That's why it was a priority. It's important to note that there will also at times need to be the need for intermittent closures as bad weather might continue to bring down, not just at Regents, but at other places anywhere along the coast. So we just encourage everyone to be cautious for that. Our maintenance crews patrol, and if something is happening and there needs to be a closure, we're going to work closely with the CHP. We let Monterey County OEM know of things that are going on. We're in regular contact and communication. So that communication has been a really good outcome as well of this effort with Regent Slide over the last few years. We've been able to be a part of any meeting we've been invited to. We gave weekly updates. We met with our elected officials. We met with our partner agencies. We had a very dynamic website that was up to date. In fact, I can put a link into the chat that has a media gallery and some videos of things that happened during the construction along Regent Slide along the way. So the bottom line is the road is open. We're very glad for that. You've probably seen in the news the reports on it, how the businesses are glad for the immediate response as well. So we just encourage everyone to drive safe and drive cautious, drive slow as they make their way through Highway 1 through the Big Sur area. Glad to take any questions or have any conversation or any details to fill in.
Yeah, thank you so much. You guys are welcome to put questions in the chat, but I did have a question. You did talk about, monitoring. So I wanted to see if you can dive a little bit deeper into how CalTrans will continue to monitor or maintain the area, moving forward, just to make sure that, if we get any more storms or things like that.
Good question. Thank you. It's interesting. There's a saying, living with landslides, and that's certainly the case in the Big Sur coast. The U.S. Geological Survey, they've mapped over 1,500 slides in the 75 miles of Highway 1, roughly between San Carpoforo Creek and the Carmel River. So it's a very active area. So we have crews that patrol daily in certain areas, not everywhere in the coast, but in certain slide areas, Regents, for example, we have certain monitoring equipment that's still in place where we'll be able to manage and track to see if there is any movement. We have regular maintenance rock scaling operations. So if during our visual monitoring there's observed potential rocks that seem to be loose or unstable, then we'll do a rock scaling operation where we'll send crews up that'll actually bring the larger rocks down in a safe manner. So that's part of our regular monitoring. But Regent Slide in particular, that was another really feat of the effort is we had some tremendous monitoring efforts with drone flights, with LiDAR survey work, just to keep track to know where the mountain was moving. And that survey work also helped us pivot to how our work was going to go with the idea of keeping the workers safe.
Yeah, well, thank you so much. I mean, this is really exciting, and now people can travel along the coast and see the beautiful scenery as they drive. So we really appreciate you being here and sharing these great news. And we'll be sure to share your link with photos so that everyone can take a look. But really appreciate you being here today.
Thank you very much.
Thank you. And thanks everyone for joining us on the news briefing this week. Our next briefing will be next week, and we'll see you then.